One milestone you'd be fine with your baby skipping is this testing of your authority. Unfortunately, it's inevitable that your baby will push the envelope a bit. If your little one's behaving badly, though, don't get too upset. Your baby is not really being headstrong per se, just genuinely curious. The best way you can correct bad behavior is by offering a firm no before moving away from the upset. And just because your baby tests your limits doesn't mean your little one doesn't adore you. In fact, it's normal for your infant to experience plenty of separation anxiety this month. If your baby has a hard time with departures, it can help to create a ritual to follow every time you leave, like a cuddle in the rocker, followed by big kisses. Because many babies who sleep alone also experience separation anxiety at night, a comforting bedtime ritual is also beneficial. Meanwhile, when awake, your baby is likely becoming more aware of moving that little body through space. Your baby may now be able to stand with your assistance, and will almost certainly bear weight on those little legs while holding on to you. Your little acrobat may even pull himself upright from his tummy to a sitting position. And don't be surprised if your baby's previously blue eyes turn a fetching shade of brown this month. Although many infants are born with light eyes, pigment increases during the second half of year 1, which is why their eyes often darken. So, be sure your baby is ready for lots and lots of close-ups as you document this fascinating process.
Get ready for more baby proofing. Your infant will start crawling this month and will have those little hands into more things than ever.
While most 8-month-olds can crawl, every baby will have his or her own preferred method of getting around. Some babies creep or push themselves around on their bellies, while others may navigate with both hands and feet, bottom pointed upward. Some babies even bottom shuffle, moving around on their behinds with a hand in back and a foot in front. Whatever your baby's movement method of choice, you can bet your little one will be into absolutely everything, which is why you should baby-proof. Pad sharp corners, cover electrical outlets, install toilet seat locks, move drapery cords out of reach, and put safety gates at the stairs. This is especially important if your baby is pulling himself upright into a standing position while holding something for support, of course. As your baby uses this newfound mobility to charge into new situations, you may be surprised to find that your baby gets scared or withdrawn. Help your little one adjust by talking to your baby softly, and allow your infant to approach new people or places at his or her own pace. You may find that your baby latches onto a blanket, pacifier, or stuffed animal for security at this time. As your baby learns about objects like these, you'll find that your little one enjoys banging, throwing, and shaking objects. He or she will probably get a particular kick out of dropping things, waiting for you to pick them up, and then dropping them again. Indulge your little one's humor when you can. After all, someday your child won't be so eager to play.
Your babbling baby may make no sense to you, but act as if you understand. After all, your little one is trying to communicate.
Most babies jabber so much because their capacity to understand language far outweighs their ability to use it. So just keep talking to your baby in specific, short phrases, and remember to watch your tone, which your baby absolutely understands. You should also encourage your baby's individual personality, which is really starting to show now. Personable or shy, moody or sunny, passionate or calm, your infant is really becoming a person at last. And while you're proud of this independence, you may find it less than thrilling when you want your baby to do something he or she is not inclined to do. Your baby's independent streak may cause some resistance when you are trying to put your little one down for a morning nap, which is something you can encourage as long as your baby can last till lunchtime without a lot of fussing. If your baby tries to blow off sleep at night, however, you'll obviously need to put your foot down. This is where a consistent bedtime ritual can be enormously helpful, as it eases your baby into sleep mode slowly. Also, make sure you actually leave your baby when you say night-night, and try not to return until he or she is asleep. During waking hours, though, your baby will love to play with you. Your infant will learn language, social, and coordination skills from his favorite activities like peekaboo, so big, and pass the ball. And another fun new play game that often gets discovered this month is how to put objects in a container and then remove them. Give your baby some infant-appropriate blocks and a bucket for this purpose, and let your little one go to town.
It wasn't long ago when your baby was content to lie on that tummy and watch the world go by. But now, your little one is up and eager to chase after everything.
By now, your little one is a crawling expert, using those hands and knees to go everywhere, perhaps even up the stairs. Many 10-month-olds can also walk while holding on to furniture, and some can even stand unaided. In fact, a few babies take several hesitant steps now, although others don't walk until well into their second year. Whatever your little one's preferred method of movement, most doctors recommend leaving those mobile feet bare for now. Little feet develop best without restrictive shoes, as being bare helps build arches and strengthen ankles. In addition to your baby's new movement abilities, those fingers and hands are more agile than ever. You probably noticed that your little one uses her thumb and forefinger to pick up small objects without having to rest her wrist on the table. Although this pincer grasp allows your baby to pick up toys, it also makes it easy to grab non-edible things from the floor as well, so be watchful. Additionally, your baby's language comprehension continues to expand as grunts and gurgles become part of your little one's mode of expression. Most 10-month-olds don't say real words, but you may have noticed some mamas and dadas in your baby's new speech repertoire. While your little one probably doesn't know what those words mean, if you repeatedly name objects your baby points at, it won't be long before you are greeted by the right word. You'll also want to continue to converse with your baby, responding to babbling as if you understand. These exercises will help your little one get a jump start on adult speech patterns, and your baby will thank you with words before you know it.
Your little chatterbox has more to say than ever, although it's unlikely that it'll make an iota of sense to you.
As your baby's brain continues to develop, so does the ability to speak and understand language, which is why your baby is gabbing up a storm. To encourage your infant's interest in language, resist the urge to use baby talk. If your baby asks for a ba, correct him by saying bottle. Introduce colors and numbers by telling your baby he is wearing 2 blue socks, or that she's wearing a red t-shirt with 3 monkeys on it. Teach your baby that language is a two-way street by conversing with her. Be an avid listener to her gibberish, and then respond as if you understand. In fact, a study recently published in the journal Pediatrics showed that adult-child conversations are strongly associated with healthy language development. Give simple instructions like pick up the cup and see if your child responds. Many 11-month-olds will. Also try offering your baby very simple choices, like whether she'd like Cheerios or cheese. Make sure she can see both options as you pose the question. During this crucial stage of language development, it's a good idea to begin phasing out your little one's binky or pacifier. It can be hard to separate your infant from this security-sucking object, but if your baby keeps it in his or her mouth all the time, it can hinder language development, according to recent research. In other big news this month, your infant may take those first real steps toward independence. To encourage baby steps, kneel in front of your child with hands out, or hold your little one's hands and walk your baby slowly toward you. Most infants will take their first solo steps by the end of their first year, but if yours does not, don't panic. Some perfectly normal children don't walk independently until their 16th or 17th month, and that's okay too.
When changing your baby, find a clean, safe surface for your changing mat so your baby can't roll off. Waist height is best for your back. A mobile will distract your baby and stop them wriggling around too much. Undo the fastenings and pull down the front of the nappy. Watch out if your baby's a boy. If they're dirty, use the front of the nappy as a scoop. Using a fragrance-free wipe, gently clean, especially between any folds of skin. If you're using cotton wool and water, change the balls frequently. Always wipe front to back to avoid transferring germs. Check your baby's back is clean. Then, try and let your baby have a few moments of airtime to dry, as it's better for their skin. Gently grasp baby's feet in one hand and slide a clean nappy under their bottom. The back with the tapes should be beneath your baby. Bring the front of the nappy up so that both sides are an even height. Attach the side tapes evenly for a snug fit. One down. About 4,322 to go. The gentlest way to clean a newborn baby is to top and tail them. If you can, stand with the bath at waist height, which is better for your back. Then gather everything before you start. Test the temperature of the water with the inside of your wrist or bath thermometer. And hold your baby firmly. Never leave them alone for any reason. Leaving the nappy on, wrap them in a clean dry towel with their head exposed, but supported. Gently wipe each eye with a separate cotton wool, wiping from the inside outwards. After you've washed them, hold them against your hip, supporting their head over the side of the bath. Gently massage a small amount of baby wash into the scalp. Rinse and gently pat dry. Now take off their nappy. Using a mild and gentle baby wipe, clean your baby. If you're using cotton wool, change the balls frequently. And always wipe girls from front to back to avoid transferring germs from her bottom. Pat them dry and give them some nappy free time if you can. When your baby is ready for a proper bath, always test the water. Use a gentle cleanser like Johnson's Baby Top to Toe bath. Hold your baby with your hand under their armpit so your arm is supporting their head. Make sure there's enough water to cover your baby's shoulders. Carefully and gently wash your baby and their bottom from front to back. Lift your baby extra carefully, as they will be a bit slippery. Dry by patting, not rubbing. Now it's bedtime. Your turn to relax. When they're tired, many babies are fussy or cry. Others rub their eyes, pull their ears, or even stare into space. The Johnson's Baby Bedtime Routine is clinically proven to help your baby sleep better, even at this tender age, which means better sleep for you. First, give your baby a warm bath with a mild baby cleanser like Johnson's Baby Bedtime Bath, which has a relaxing natural calm aroma. Then, give your baby a gentle massage. Research has shown that the health benefits of massage are significant, and this is a perfect time to bond with your baby. Finally, read or sing softly. Avoid active play so that baby goes to bed sleepy, but still awake. This will help your baby learn to self-soothe, so they'll be more able to put themselves back to sleep if they wake at night. Don't let the bedbugs bite.